Understanding high blood pressure. Did you know that your blood pressure can be a good indicator of your heart's health? Did you know that high blood pressure is also called silent killer? Do you know how to interpret blood pressure readings? High blood pressure, also known as hypertension, is the most common cardiovascular disease. High blood pressure is actually a leading risk factor for heart disease and early death. It's sometimes called the silent killer because many people don't know they have it. Yet, an elevated blood pressure can do a lot of harm. In the World Health Organization report of September 2019, it is estimated that 1.13 billion people worldwide have hypertension, most of them living in low and middle income countries. Blood pressure is the force of blood pushing against your artery walls as it goes through the body. Like air in a tire or water in a pipe, blood fills your arteries to a point. Just as too much air pressure can damage a tire, or too much water pushing through a garden pipe can damage the pipe, high blood pressure can harm your arteries and lead to life-threatening conditions like heart disease and stroke. Measuring your blood pressure is simply measuring how hard your blood pushes against your arteries as it moves through your body. Blood pressure rises and falls naturally during the day, but if it stays high too long, over time, it can lead to health problems. If you are new on healthy habits, you can consider subscribing so that you will receive a notification whenever we put on a new video. Why knowing your blood pressure matters? Blood pressure can affect your body in many ways. Untreated high blood pressure increases the strain on the heart and arteries, and it can eventually lead to blood vessel damage or atherosclerosis, heart attack, stroke, heart failure, kidney failure, eye damage. Often, there may be no signs or symptoms that tell you when your blood pressure is too high. Not surprisingly, the higher it is, the more likely you are to have these problems. What is the good news? High blood pressure can be treated or even prevented. What do your numbers mean? Blood pressure is giving us two numbers. You've probably heard your healthcare provider say something like 130/70. So what do these numbers really mean? Systolic pressure, the top number, is the pressure or force in the arteries when the heart pumps. When the heart contracts, the pressure in the arteries rises. Diastolic pressure, the bottom number, is the pressure in the vessels when the heart relaxes between heartbeats. These numbers are measured in millimeters of mercury. Hypertension, then, is blood pressure that is above 140 millimeters of mercury for the systolic and or above 90 millimeters of mercury for the diastolic. You can have high blood pressure even if just one of the numbers above is higher than what it should be. Let's look at this table for blood pressure classifications. Take note, this table has been simplified as much as possible for beginners. Normal blood pressure means a systolic blood pressure of less than 120 and a diastolic pressure of less than 80 millimeters of mercury. Prehypertension means a systolic blood pressure of between 120 to 139 and a diastolic blood pressure of 80 to 89. Hypertension means A systolic blood pressure of greater than 140 and/or a diastolic pressure of greater than 90 millimeters of mercury. People with readings of 140 on 90 or higher on at least 2 occasions are said to have high blood pressure. If your blood pressure is only slightly elevated, like in pre-hypertension, you need to take it seriously. Blood pressure measures that are too close to the cutoff for having hypertension can serve as an early warning sign or a red flag that it is time to step up efforts to prevent high blood pressure. In conclusion, high blood pressure in itself is not a disease, and it occurs most of the times without symptoms. If left uncontrolled, it can cause severe and sometimes irreversible damages on vital organs such as the brain, the heart, and the kidneys. Luckily, with the use of antihypertensive drugs, most people succeed in bringing down their blood pressure to normal levels and are able to prevent the multiple organ damage. Talk with your healthcare provider about learning how to check and track your blood pressure over time. Check your blood pressure as often as you can to know your values. And if you ever notice an elevated blood pressure, make sure you talk to your doctor. Thank you.